Hello and welcome to the One Test Prep. We are so excited to have today. Today we have with us a very special guest, someone who is a public figure in mental health and constantly working to improve the lives of others around him. He has been not only a person who is a rising star in our profession, but he's also putting in the real ground level work.
Oh, thank you, Jason. It's a pleasure to be here. My name is Arron Muller. I'm a licensed clinical social worker in the state of New York and New Jersey, and I'm a school social worker. I do private practice, and then I have a not-for-profit where I do mental health events, and I'm currently doing my DSW at Simmons University. So that's quite a journey. And just wanted to highlight that Black men in social work, and I think visibility is really important.
Mm.
So we out here, social workers, we're out here.
I love it, man. I love it. I love it. I love it. I was privileged, absolutely privileged to play a small part in you earning that LCSW license when you came to the One Test Prep to get
Yes,
some additional support with your preparation process. And so, again, it's something that I'm thankful that whatever bit we did to contribute to you getting that license and overcoming that exam, I think
yes.
every little bit counts.
Oh, it did. It did. It was really helpful. I attended the group virtual session,
Mhm,
and it was like literally days before
mhm,
the exam, and that was my third attempt. And I really needed to switch up my approach, so
mhm.
that was truly helpful.
Today, you chose the topic today, and you chose that you wanted to talk about the components of intervention, treatment plan. Talk to me a little bit about that. Why is that important to you?
Well, it's definitely like mapping out the journey, and I always say as the provider, we are not the expert in our clients' lives, right? They are
Mhm,
the expert. They know what
mhm,
they need to do. We are providing that clinical guidance and support. So I always say that we're in the passenger seat and
mhm,
they're driving the vehicle, right? So
mhm,
but we can't go on a trip without a clear destination, right? So the treatment plan kind of gives us that route, that direction, and we take in consideration the various aspects of what they're going through, and then we could decide together upon achieve what specific goals they need to achieve within a particular time frame.
You're absolutely right. And that's it's so important that social workers who are watching these videos understand that it is not our job to determine on behalf of some of our clients or our patients what they need. So we can certainly point out areas of need, but we have to allow for and create space for self-determination,
Yes.
which is one of our core principles of social work. And
Yes.
so prioritizing is a big part of treatment planning.
Absolutely. So, why I chose this topic because I feel that, and I'd even add that I'm a adjunct professor also. So, being on the other end, student and teacher, seeing some of the gaps when students, come to me about the exam and them not always feeling prepared. So I feel like this is a particular topic that I see that's truly important, like assessment and diagnosis, and not knowing what treatment plan to do and what, objectives and things like that. So I think that's why I chose this topic.
So on the screen, we have the components of intervention, treatment, and service plans. This is actually a worksheet that is included in ASW in our exam prep material in our modules. But we're sharing it with the public today, again, absolutely for free. Developing an effective treatment plan is like mapping out a journey, right? Just as you wouldn't set off on a trip without a clear destination and a route to follow, creating a treatment plan requires careful consideration and planning to achieve specific goals. The first step in that goal process is assessment.
So with the assessment, it's important to really pay attention to the questions. Um, Look at what they're asking you to diagnose or assess. pay attention to key details, be mindful about adding on, especially for those that have been in the field for some time, adding on additional diagnoses, additional
Mhm.
locations, adding on additional ethnicities based off of what we think. Right. So if the question stems, may say it's an African American male from Brooklyn, New York, and it gives you a kind of example. Oh, I had a client like that, and that's where we mess up. So focus entirely on what's in the question. Do not add anything. Do not take anything away. Do not assume that they're missing information from it.
When we talk about diagnosis, now this is something that intimidates a lot of social workers,
Yeah.
but diagnosing in and of itself, it requires us to be professional listeners.
Yeah.
And I'm going to say that again so everybody can hear me. It requires us to be professional listeners because going back to what Aaron just talked about when it talks about assessing, assessing is not just what the having giving a person a form to fill out. Assessing is assessing their body language, assessing their continuity, right? If there's continuity or discontinuity between what they're saying and how they're presenting.
When you said diagnosis, I think knowing diagnoses is truly important. The criteria and the duration. I think that's where people fall short too. So really having a mastery of especially the basic ones. I know it's hard to kind of remember, but really study bipolar disorder and knowing the duration, schizophrenia, schizophreniform, schizoaffective disorder, knowing the criterion for those diagnoses and the duration, because that will determine the difference between the diagnosis. And that's where we fall short. So with goal setting, of course, we want to, it's in collaboration with the client, but it's also tangible goals and they should be measurable. So if they're asking you a question about that, it should be measurable goals. It should be in collaboration with the client. And you just want to make sure that it is achievable. So that's where we come in, right? So if it's something outlandish, it may not be an appropriate goal. Setting goals is akin to determining checkpoints along the journey to track progress. And if they don't meet the goal, kind of come back, look at it, and kind of reassess where it didn't work out, and then establish new goals. Okay, so putting the treatment plan into action is showing that all elements are executed. Right. So you're following up, checking in based off of what the recommendations are, and checking in to see how they are going towards achieving those goals. Like I said before, if there is a challenge, you're kind of looking back and assess. But implementation is one of the biggest pieces in terms of working with the client and getting them to achieve their goal.
Yeah.
Um, within that timeline, right? So the within 6 months, right? They maybe want to work on being able to establish and utilize coping strategies when feeling anxious. So that's one thing you may have, right? So when the
Mhm.
implementation comes in, during the sessions, you're giving them tools, the processing, how they doing with it, and
Mhm.
checking in with them. Well, how you were able to achieve work towards that, right? So if they were able to achieve it 2 out of the 3 times, then that's a step in the right direction. So I like to use, percentages or a 2 out of 3, or 2 out of 5 times. If I'm working with a student, we're able to
Mhm.
find ways to calm down. Putting the treatment plan into action is showing that all elements are executed. Right. So you're following up, checking in based off of what the recommendations are, and checking in to see how they are going towards achieving those goals. Like I said before, if there is a challenge, you're kind of looking back and assess. But implementation is one of the biggest pieces in terms of working with the client and getting them to achieve their goal.
There you go. Implementation is a big part of it is getting into the nitty gritty. And that's really where this next step, monitoring and evaluation, comes in. Because when we talk about monitoring and evaluation, I give you a tool, but you have to learn how to use that tool. And I have to teach you how to use that tool. And if that tool is effective for you, then you'll learn how to use that tool even if I'm not around or involved. And
And
so
that's
we
what
all
and that's what the
operate.
real work is, right? That's what the real work is outside of the therapy
Mhm.
session, right?
Exactly.
Yeah. So review and revision. Regularly review the treatment plan with the individual, right? Because they are part of the process. We are not the experts in their lives. We are providing, providing answers. So check in the goals and revise the plan accordingly.
Mhm.
This step is akin to recalibrating your journey based on new information or unexpected developments, such as any like today I was coming home from work. I used the way I usually take it was traffic nonstop. Had to take another route. Uh,
Mhm.
right, it derailed me. I was a bit upset, but I still made it to my destination. Right, so
Yeah.
sometimes when we have to review the treatment plan, it wasn't effective. Maybe uh, journaling is not effective, right? Some people are not writers, and I'm very mindful about that.
Let's do a practice question together, for our viewers, and that way they can see how these kinds of things show up in the context of the social work licensing exam.
Okay. Yes. So, what should the social worker do when using evidence-based practice methods in developing a treatment plan with a client?
So the first one is going to be base the client's treatment plan on a theoretical approach. Sounds reasonable.
Right.
B, use treatments that have been successful for others with the client's diagnosis. I like that. C, consider client preferences and values when arriving at a treatment plan. That's important. And D, consult practice textbooks to find an applicable therapy model. Now, keep in mind, Aaron, this is the part that I always tell people all the time. ASWB doesn't do tricks. They don't put throw off answers on the exam. They don't, if they ask you what's your favorite fruit, the four choices are going to be apples, oranges, grapes, and bananas. They're not going to say apples, oranges, cake, and video cameras. Like they're going to give you four choices that are actually fruits. And so you need to know that every one of these options here feels like it could be a reasonable answer, but this is why we focus on the STEM to help us break it down, right?
Right.
So when we're looking at the STEM, Aaron, tell me something that's important that stands out for you that's like super critical to help us find the key.
Definitely, my eyes, if I'm sitting for the exam, I'm looking at evidence-based practice methods, right? So my eyes going there.
It's right
That's
there. It's right
yeah,
there.
that's my first thing, right? And then for me, I always look at the role that I'm playing, right? Because am I the social work supervisor? Am I the intake coordinator? So I think
Mhm.
so paying attention to that. So my second thing is okay, I'm the social worker and I'm using evidence-based methods. So that's where my brain stops. Okay.
Yeah. I'm developing a treatment plan. And so that developing a treatment plan is going to be critical. Give me one of these that you know for sure we can eliminate.
So I'm looking for consult practice textbooks to find the applicable theory model. So D I would get rid of.
I would totally agree with you on that. And so, Aaron, if I had to eliminate another one, even though it's super important that we base the client's treatment plan on a theoretical approach, I'm going to say that we are not going to use that as the key here, because when we talk about using a treatment plan that is based the client's treatment plan on a theoretical approach, we already identified that we're using an evidence-based practice
Evidence-based.
method. And so that's, again, the STEM is telling us important information and we already have it highlighted. So with that being taken into consideration, we have two options left. Professor Muller, Dr. Muller, tell us what would you find is the key?
If I'm a social worker and I want to ensure that I'm using an evidence-based method in developing a treatment plan, I have to know what an evidence-based practice is. And when we did our studies, we know that evidence-based practice is research that's
Mm-hmm.
been done and found to be
Yep.
effective
Yep.
based off of the sample size and the research and the findings, and
Mm-hmm.
that it has been successful with the sample size that they done the study with. So that gives us the answer That is B, use treatments that have been successful for others with the client's diagnosis.
And look at that. This is a recall question, and key B is the only answer that fits the definition of evidence-based practice. Because evidence-based practice has a track record of success. That's kind of why it's called evidence-based.
Through your career, you'll definitely build more knowledge. And as a clinician, as a researcher, as an advocate, um, when you have to speak for people or have conversations with different parts of an interdisciplinary team, um, important to have that language to be able to express yourself because we do bring a dynamic thought process to the conversation. We're thinking about so many different aspects when working with clients, students, patients, whatever setting you're in, which makes us so unique because we're looking at so many different ways things could be done. And when say we're working with a student, we're also thinking about the parents, right? We're like, how can we get support for the parents in this? Because we realize that it's just not, it's different factors in terms of what makes someone whole, right? It's not just the particular person.
But in the one test prep, we have this included in our tools for people who have the modules. There's a glossary of literally all these mental health and terminology.
Focus on these words, master them because they may be in the question, they may be in the stem, or they may be in one of the responses. If you say, "Oh, well, I know it's not anhedonia," right? I know what that means. So that's it's not, and so
Exactly.
I can cross that one out. I know it's not. I know what kind of tonic means, and that is
Mhm.
not in this stem here. That's not part of the diagnosis. So truly, truly important.
Absolutely. There's social workers, though, that are all over the country and, in fact, all over the world, and sometimes not in a well-populated area, sometimes working very rural. And
Right.
so, for those social workers, it's so important for all of us social workers, it's so important that we keep clinical supervision going because it helps us not start coming up with clinical interventions that are not evidence-based. Because if I'm working in a clinic where there's no other social worker for 75 miles in any direction, and I got a patient in front of me who's depressed, and I say, you know what? You're not yourself when you're hangry. So my clinical intervention is going to be you have a Snickers, okay?
Right.
I need you to have a Snickers and have a Snickers before you come in to work tomorrow, and you'll be better. Snickers every day. That's my clinical intervention. Is that evidence based?
It's
No. That's a commercial,
a
right?
commercial. Right. And you may found that, and the thing is that you may find it effective, but for this exam, it's not right.
Absolutely. Answer the questions as if your license depended on it, because it does. So, Arron Muller, man, what a pleasure to have you here today. I'm so thankful. It's been a joy. I really enjoyed connecting with you, partnering with you.